Good morning. Thank you so much for joining Forge Breast Cancer Survivor Center Coffee Conversations. We're so excited this morning. We have Leah Riley back with us to talk about managing trauma in breast cancer treatment after, during, whenever that time period is for you. So Leah, for those who are new to Coffee Conversations, new to Forge, new to you, could you introduce yourself, what you do, and then we can get started with the questions.
Yeah. Thanks for having me. Welcome, ladies. It's such a joy to be here. I'm excited to talk to you guys about all of this. And I'm a counselor at Oasis, so I'm an LPC. Um, I have been here for almost 7 years, been in the field of counseling since 2015, so a while. And I practice EMDR, which is actually a trauma therapy, and have had several Forge clients as clients here that I've seen. So yeah, it's been such a joy to help and try to help women cope with this type of diagnosis. So yeah, I've got two boys, 3 and 1, age 3 and 1. So you can imagine my house is not quiet and we don't need anything that can break, right? So don't, yeah. So that's kind of a little bit about me.
I totally relate to that. I'm a mother of five, ages from 9 to 6 months. So I totally get the vibrancy of a home with
Oh yeah.
babies. And
Yes.
it makes your day so much more interesting when they would probably otherwise be very boring.
Yep.
So I'm so glad that you're here with us. I wanted to kind of delve into trauma because I know we were talking a little bit before the call, but we really want to kind of break down what trauma means, right? Because some individuals might not necessarily identify with that word because it is a very heavy word. And then some people might associate it with other things and they don't realize that trauma can go across many different situations in life. So if you could for us, Leah, break down, what does trauma mean? How do you define that?
Yeah. So trauma is something as simple as, which a lot of us can think, it sounds like a big thing, really, but it's a deeply distressing or disturbing experience. That's it. Deeply distressing, disturbing, right? And cancer is deeply distressing and disturbing, right? And it's anything that's a threat. Cancer is a threat. So um, with trauma, it's the oldest part of our brain, which is in the back, the reptilian brain. Whenever we experience something or our system experiences something that is a threat, deeply distressing experience or disturbing, that becomes activated, right? So that's our fight, flight, or freeze response. We don't get to choose that because everything else in our brain shuts down when this becomes active. So we don't get to pick if we fight, flight, or freeze or how we respond to something distressing immediately. We get to learn how to cope with that, right? Yeah, so trauma is something that is a deeply distressing or disturbing experience. And so, yeah.
Thank you for defining that so simply. Believe it or not, I've never heard the definition of trauma. Like I've always just kind of associated with stress and distress and all of these different things. So thank you so much for making it plain and defining it for us. What are some common emotional, psychological challenges that a breast cancer survivor might typically face during treatment,
Mhm.
diagnosis, thereafter treatment? Because there's an experience even after treatment has stopped for some. Can you kind of tell us about what are some things that you've seen in that setting that kind of closely relate to trauma?
Yeah, so I mean, anxiety, depression symptoms, redefining identity as far as this is part of the narrative of your life, right? So how does that look? And I don't want this, and I'm also coping with it at the same time. So it's a both and. Um, and also you still have value as a person, regardless of the diagnosis or not, right? So I would say the challenges are anxiety, changing in relationships potentially. Um, uh, the new identity is changing. And so how does that look when it comes to kids? So that some things may look the same, right? And then other things are different, and you don't know, well, should this look all different, or should it look a little different? Or and really it's just the internal process of grieving something that you didn't know you were going to have to grieve a little bit, um or a lot of it. And also knowing that we're created to survive as humans, and that we are, I don't want to invalidate anybody's feelings, but I think it's just amazing how the human brain can protect us and morph and heal and be resilient when it comes to, as we're able to grieve through something that we didn't know we were going to have to grieve, we learn to um, move through that and be able to be present. And so I think you can all be present in your present life with where you're at with your diagnosis, and then also at the same time grieve at times. So it's kind of like, um, it's a both and, right? It's not like my life is over now that I have this diagnosis. Maybe it feels that way, but it doesn't have to look that way, just if that makes sense.
It
Um,
does.
yeah.
Is like kind of, I know we had a good chat before the call, but I also wanted to kind of bring up some things that you had said, like when we think about like when someone is diagnosed with breast cancer, as you mentioned, grieving, right? Like because you're grieving hair, your body image, the norms of your life prior to all of these different aspects of a person's life changes and the people attached to them, right? Because then the person that you cared for might need to care for you now. There are things that you might not be able to do anymore. And I think that even thinking about those types of changes, because change can traumatize individuals when it's very sudden, or they might, feel like this is just me adjusting to the change, but really
Mhm.
you're just minimizing what it actually is. Try not to give the word trauma any power.
Mhm.
And so I think that that's very important to recognize that it is this is happening, and it's a but and like you mentioned.
Mhm.
So thank you for kind of I've never used but I like that.
Yeah.
you know
Yeah,
because
it's
it's a
a
but
it's a
and.
and yeah, it's a both and really, because it's like you've got both, you're walking alongside both realities, right? Um, yeah. So, um, yeah,
Yeah.
yeah, go ahead.
So what are some ways that you think trauma from breast cancer treatment can impact someone's overall well-being, like whether they move past like, okay, I'm not in treatment anymore and now I'm in survivorship. What are some ways that not addressing the trauma can affect them, right? Because yeah, they might experience it, but they might not address it. They may not know to address it. They might just think that this is just part of the motion with the ocean, but really they might need more therapy or whatever have you not to kind of process that experience so that they can move forward in a healthy way.
Yeah. So I think that if, not addressing the trauma or the reality and processing that and how that trajectory and diagnosis doesn't define you, and it is also something that's part of your narrative. Um, I think that's something important to remember, that cancer isn't you, and cancer is part of your life now, whether you're in remission, whether you're recovering, whether you're going through treatment. Any of those, if it has touched your life at all, it is now part of your narrative. And that right there, I think is something that you do grieve. You grieve the expectations that you thought you were going to have, and it doesn't mean that you can't have expectations, if that makes sense. So I think that being able to talk through what that means for you and your identity is a really big thing at the beginning of, treatment, and being able to identify, yeah, this did happen, and how did that change how I look at the future, the past, the future, and the present. And looking at all the future, past, and present, and how that changes, and processing that, and being okay with whatever, right? Being okay with giving yourself permission to be okay with whatever you're feeling about it, whatever you're thinking about it, having a space for that, and then saying, okay, now I have a space for that. I'm going to process that with all the just, maybe despair or discomfort, guilt, all the things, then I'm going to continue my day. So having a space to pretend to process that is really important, and give yourself permission to, because there's no right way to be diagnosed with cancer or right way to have it, right? Or have had it. There's no right way, no wrong way. It is just individual for each person. And so being kind to yourself and giving yourself permission to feel however the heck you want to feel. Um, and kind of you could even, contain that to therapy, you contain that to support groups, and then give yourself space to live presently. And then when you need to grieve again, you go back to that space and you grieve, and then you go and live, right?
Mhm.
And so, yeah, I don't know if that answers your question.
It does, and it kind of answered the question that I was going to touch on later too about, how does a person prioritize that, right? Because people just want to get through it, or they feel like, I'm already doing this. I'm already having someone care for me. I'm already having all of these things shift in my life. How dare I have also this to address?
Right.
And now I'm having these side effects. So you kind of answered that. And what I heard you say was you have to give yourself the grace and the space to feel what you feel so that
Mhm.
you can move on to the next step and whatever that might look like for you.
Mhm. Yeah. And I think remembering too that how you feel about your diagnosis doesn't, you aren't your feelings about it. You don't have to be your feeling. You don't have to be despair if you feel despair. You can feel the despair, right? But you also know, I'm alive today. I'm alive like in this moment, and I have these things today. And I can feel despair in another moment, but maybe I have some despair there in the back, but I'm going to continue to, I'm going to go get my coffee and I'm going to sit with my son, or I'm going to sit with my um dog and pet my dog and be mindful, right?
Mhm.
So um I think that remembering that we aren't our feelings and those don't define us is also important as well. Um it's, yeah, because we're still valuable humans in wherever we're at, so, or in the process, and have value regardless of how we're feeling about it. Yeah,
Yeah.
well, go ahead.
Well, I was just going to say that, you know, oftentimes it's very hard to validate ourselves. And so we look for it externally
Yeah.
too, especially like when there's just so many changes in your life that you just don't know the certainty of it. It's hard to feel the certainty of what it is. Like, am I looking at this through a point of view that is pure emotion or whatever have you not? And I think that might also kind of be a barrier for people addressing what they need to address because they're unsure of, this is my experience.
Right.
What are your thoughts on that?
Yeah, I think that the overwhelm of the diagnosis can be really hard and make it really hard for people to make decisions, and about their treatment or what the next step is, or what they want to do. Their doctor's saying this and their oncologists and say, all the things. And so I think a big thing on that is accepting help and talking through that with a support, either a group or a person. But you're more often than not, after a cancer diagnosis, it's okay to accept help more often than not, right? So it's a change from giving help or being a helper to accepting help first, and then you can be a helper. And so I think being able to talk through those things like diagnosis, trajectory, what that looks like through the overwhelm, and asking someone, hey, I need you to help me think through this or process this, because there are emotions in it that make it hard for us to think clearly, right? Which is okay. It's okay that you're overwhelmed. It's okay that it's hard to feel like you can't think clear. Like, it's okay for that. And that's why it's so crucial, either if it's somebody at Forge, if it's a counselor, if it's a loved one, family, friends, to be able to talk through these things. And you are not weak or, inadequate for having those questions or feeling like, I don't know if I can make these decisions for my life, but having help in them, um, for someone that's can help you think through them and move through some of the overwhelm. Um, and at the end of the day, giving yourself space to have those emotions, and then also know that remember what you know, which is I'm still alive, I'm still here, and it's okay that I need help, and I'm gonna take the next step. So one step at a time. And tomorrow I may feel differently, right? And so I think accepting support, help, having someone to listen through your thoughts and feelings, crucial, crucial. Um, yeah,
Yeah, it is. And then, I guess that's one of the things that someone can do, as they try to cope and manage the emotional lift, the emotional burden that some might identify with following their treatment. Um, so I wanted to know, what are some other tips that you have, or helpful tips that you have for someone who's having a struggle identifying with, I've experienced trauma, whether it's physical or emotional, because I think that sometimes people associate the word trauma with the disorder, post-traumatic stress disorder. So they're just like, well, I'm not running down the street yelling about this or
right,
yelling about that. Some people might have a different perspective about what trauma can look like on individuals. So if you could, can you kind of tell us, I guess I asked you two questions in one, but if you could kind of tell us a little bit about, how someone can begin to accept that, hey, I've experienced trauma, because trauma is, extreme distress. It is distress, or it is, the definition that we described earlier, that you gave out earlier, versus I have post-traumatic stress disorder.
yeah,
And then if you do have that diagnosis, coming to terms with that, that
right,
doesn't make you weak. It doesn't make you anything other than someone who needs more help to process what you've gone through.
right. Yeah, I think, yeah, it's definitely, yeah, I think that's the hardest part about it is it's really sadness, right? Or grief of this thing. And also the trauma, meaning like you can't decide, we don't get to decide as humans what is traumatic to us. Our brain does that for us. And what's really, I think, amazing about how the brain works and how our bodies are made is that when we allow ourselves to feel sad and grieve something, it is easier. I'm not going to say easy. It is easier to move through that as we like let some of that out, as we grieve and express some of that sadness, because there is sadness there, right? That doesn't mean we're always sad every day, all the time. Maybe there's periods of that, and life is still continuing. So I think being able to accept that this is trauma, and at the same time
Mhm.
I'm still alive, I have feelings, I have this diagnosis, and I'm still alive, and I'm still going, right? And so I think being able to accept that, yeah, I've had trauma and that's okay, and I need to be really kind to myself, um, because I may not know and can rely on my feelings, so I need others to lean on as well. And that's okay, and that's allowed. So I really think, and we all respond to trauma differently. So yeah, I think that's a huge thing to remember as well. Um, so yeah, it's hard to answer without an individualized example, I think. But
Yeah,
um,
yeah. I mean, because it is so individualized,
right,
because journeys are very individualized, and feelings and all of those things. So I do appreciate you answering it as broad as you possibly can.
yeah,
Um, but before we wrap, I did want to know, I guess, two things. Um, I know you mentioned earlier about support groups, or a single person. I kind of want to know, one, what are some resources that you think are particularly helpful for individuals who've experienced trauma, especially those in breast cancer, because that is very specific as to, what they go through physically and the aftermath of that, because it doesn't stop after you've stopped your medicine. You have all of these other appointments, and, the anxiety about, it's time for my annual mammogram, and now I'm reliving, when I got, what life was like before I got diagnosed, and, all of those different things. And what final thoughts that you wanted to leave our viewers with?
yeah, yeah. So I would say, building a relationship with your doctors that you trust, is a really good resource. And if you don't feel that you can trust them, you don't like, you're uncomfortable, or figuring out a way to connect with them is a really important thing. I think PODA is also a huge resource. PODA is the uh, Psychosocial Oncology Training Academy workshop, and that's the, or not workshop, but the academy, and it's extremely important to look at that, because it has so many things. I'm actually looking at the website, or I was earlier, but there's so many resources that you can get through there. Very, very helpful. Another resource is just, I mean, support groups. I know Forge has that. PODA can connect you with those, a counselor, a spiritual outlet or leader that you can speak with, or somebody through a spiritual outlet, whether that's church or some other group or community that you can be a part of. I think community is extremely important during this as well, to have people to lean on and know about the situation that you're going through. Because as hard as it is to accept help as women, right? It's hard for us to accept help, especially as moms, women. We want to be able to do it all. And accepting help is like such a loving thing or strong thing to do, because cancer is bigger than you are, right? And so you need the help, and it's okay. And if you have trouble asking for help, tell someone, hey, I have trouble asking for help. How do I do that? Whether that's someone you trust, counselor, it doesn't have to all be counseling, but just somebody to sit with you as you think through and feel the feelings and have your thoughts. That's going to be really important. And so other resources, I was trying to think. I mean, Forge has, y'all are probably the resource hub. So
Yeah, we
y'all,
do
y'all
a
are,
lot of things.
yeah, yeah. Um, yeah.
Well,
So
thank you so much, Leah.
yeah, no,
Um, I really enjoyed this conversation. I love talking about mental health, obviously, because my background is in mental health. But I really appreciate your ability to kind of just break it out and as broadly as possible for individuals who might have issues identifying with the word trauma
yeah,
and linking it to their experience with breast cancer because it's very valid.
yeah,
So I'm hoping that those who viewed this conversation hear that and resonate with that. And if that's something that they can relate to, they're able to kind of get the help that they need or process in a way that is more beneficial so they don't feel like, well, now I don't do this because this is what I went through. And they think that that's just absolutely normal when really it isn't. And that's okay. So I really appreciate you for providing that space. And we really enjoy having you on our coffee
yeah.
conversations.
Thanks, guys. Yeah.